So in today's question, we are looking at antenatal care, and we'll go straight to look at the scenario that we are dealing with today. So the question says, Mrs. Tanyarazwa Manyarathi comes to the clinic where you are working for her first antenatal contact. Her last menstrual period was on 20th December 2024. Question A says define antenatal care. B says explain 5 investigations that will be done during this contact. C says describe the information, education, and communication you share with Mrs. Manyarathi under the following headings: hygiene during pregnancy, danger signs of pregnancy, birth preparedness, nutrition during pregnancy, and disease prevention and medication. And question D says explain the presumptive treatment of malaria in a pregnant woman. We can define antenatal care as this is the care that is given to a pregnant woman from the time that conception is confirmed until the beginning of labor, with the aim to ensuring the health and well-being of both the mother and the baby. The next question was talking about investigations that can be done during antenatal care. We can, of course, do full blood count or hemoglobin estimation rather. And when we talk about full blood count, we are trying to detect anemia or other blood disorders. We can do blood grouping for cross-match and rhesus factor just to help plan if the mother is rhesus negative, and this will help prevent hemolytic diseases in the newborn. We can do RPR test for syphilis, and this will help detect any presence of syphilis and, of course, early treatment. During antenatal, we need to do HIV testing so that if the mother is positive, we initiate the prevention of mother-to-child transmission. We can do urinalysis just to rule out complications like preeclampsia or gestation diabetes and just presence of infections. Now, in terms of the IEC question that was given, it said give IEC in terms of hygiene during pregnancy. Now, the IEC you give during pregnancy is that it is important for Mrs. Manyarazi to maintain good personal hygiene to promote her health and that of the baby. She should bath daily to keep the body clean and prevent infections, especially in warm and moist areas where bacteria may thrive. You can encourage the woman to wear clean, loose-fitting, and comfortable clothes to help improve circulation and reduce risk of irritation. Apart from that, you can encourage the woman about good oral hygiene, which is important so that she should brush her teeth at least twice daily and visit the dentist if it is necessary. In addition, regular and thorough hand washing with soap, particularly before eating and after use of the toilet, should be encouraged to prevent disease transmission and any other infectious disease. The next one said danger signs of pregnancy. During this heading, you can give IEC to Mrs. Manyarazi such that she should be informed about the key danger signs of pregnancy that require immediate medical attention, and these may include vaginal bleeding at any stage of pregnancy, severe headache, blurred vision, or swelling of the face and hands, which may indicate preeclampsia. Apart from that, observe for any severe abdominal pain, persistent vomiting, or even high fever, which are also included as warning signs. You can also encourage the pregnant woman, to observe any leakage of fluids from the vagina before term, as well as any reduced or absence of fetal movement after the baby starts kicking. And she must also report this agent to the nearest healthy facility. In terms of birth preparedness, it is important for Mrs. Manyarazi to prepare early for her delivery. She should decide on the place of birth, preferably a health facility, and identify a skilled birth attendant who will assist her during delivery, especially where delivering from a private hospital. This may be done, but at a government facility, you may just be attended to anyone who's available during that shift. Also, you can encourage this woman to save money for transport and other possible emergency costs, because the mother may have missed out certain things during preparing. Hence, money should also be available. She should also prepare all the necessary delivery items such as clean clothes for the baby, sanitary pads, and also clothes for herself. In terms of nutrition during pregnancy, here you encourage good nutrition during pregnancy because it is vital for both the mother and the baby. Meaning that Mrs. Manyarazi should eat a balanced diet that includes adequate proteins, carbohydrate, vitamins, and minerals. And she should consume plenty of fluids, vegetables for vitamins, whole grain for energy, proteins for protein-rich foods like beans, fish, eggs, meat, all those would be encouraged to this woman. Drinking enough water, and of course she should also avoid harmful substances like alcohol, tobacco, excessive caffeine, and also she should make sure that you should make sure or encourage her that she is taking iron and folic acid supplements as well. The last one is disease prevention and medication. And here, to prevent diseases during pregnancy, you advise Mrs. Manyarazi that she should attend all scheduled antenatal visits where preventive services such as immunization and screening are provided. She should also sleep under an insecticide-treated mosquito net every night to prevent malaria, and also take intermittent presumptive treatment as prescribed. It is also important to avoid self-medication and only take drugs that are prescribed by a qualified healthy worker. At the same time, she should also complete all required vaccinations such as tetanus toxoid and follow all the medical advice to ensure both her safety and that of her unborn child. The last question was talking about the presumptive treatment of malaria in pregnancy. Now, in malaria or individuals who live in high endemic malaria areas, they are usually given sulfadoxine pyrimethamine. So Fancida is used as a presumptive treatment for malaria, where most you give 3 tablets of sulfadoxine pyrimethamine, which you commonly know as Fancida, and it has 500 milligrams sulfadoxine and 25 milligrams pyrimethamine. It is taken orally at once under direct observation, observed therapy at a health facility. That's why you are forced to take these drugs at a health facility, so that we are very sure that you have taken these drugs. Frequency, at least you give 3 doses given at 4 weeks interval until this woman delivers. Additional prevention can also be given to prevent malaria, such as use of insecticide-treated mosquito net, and of course environmental control of presence of mosquitoes. Now, the mode of action of Fancida is that it inhibits folic acid synthesis in malaria parasite, but it may give certain side effects like loss of appetite, anemia, and headache. Hence, during nursing implication, you will also avoid giving the drug in the first trimester to reduce congenital problems. And this is why during the first trimester, if the woman suffers from malaria, even if it is uncomplicated malaria, they may still be given artesunate because Fancida or Coartem may not be suitable in the first trimester. So that is how we can answer this particular question for antenatal care. Till next time, goodbye.